Hi, my name is Olivia Beck, and I am a family nurse practitioner student at Auburn University. I'm going to talk to you about advanced practice registered nurses and their role specifically in South Carolina. So first of all, what are nurse practitioners? Nurse practitioners are registered nurses who have gone back to school to continue their education and have obtained either a master's or a doctorate degree, allowing them to become advanced practice registered nurses. Nurse practitioners are nationally certified either through the American Academy of Nurse Practitioners, which is the AANP, or the American Nurses Credentialing Center, which is the ANCC. Nurse practitioners are licensed by their state. Therefore, they practice under the regulation and rules of their specific state where they are residing. So what exactly can nurse practitioners do? They are able to order, perform, and interpret diagnostic tests such as lab work and x-rays. They are able to diagnose and treat acute and chronic conditions such as diabetes, hypertension, infections, and injuries. They are able to prescribe medications and other treatments. They manage the patient's overall care. They counsel the patients, and they educate patients on disease prevention and positive health and lifestyle choices, such as smoking cessation. So South Carolina falls under the Restricted Practice Authority for nurse practitioners. Now, this is different how other states are following either the full practice authority or the reduced practice authority. So with the full practice authority, nurse practitioners are able to practice independently without a collaborating physician. Reduced practice authority allows nurse practitioners to practice without MD collaboration in certain settings, whereas in other settings, they still require the collaboration agreement. However, in South Carolina, since they do fall under the restricted practice authority, nurse practitioners must enter a collaborative agreement with a physician in order to practice at all. The state practice and licensure laws restrict the ability of nurse practitioners to engage in at least one element of nurse practitioner practice. The state law requires career-long supervision, delegation, or team management by another healthcare provider in order for the nurse practitioner to provide patient care. So with that collaboration agreement, nurse practitioners are still able to regulate the patient's care, and these are outlined under the South Carolina Code of Laws in Chapter 33. The summary of this Code of Laws includes the ability of the nurse practitioner to certify a student that is unable to attend school but may benefit from instruction at home or in the hospital. They are able to refer a patient to physical therapy for treatment. They are able to pronounce death and sign a death certificate. They're able to order hospice for a patient if they seem fit. They're able to certify an individual as handicapped and declare that the handicap is temporary or permanent for purposes of a placard. They're able to perform tasks via telemedicine, and they're able to enroll with Medicaid, where nurse practitioners are reimbursed up to 80%. The Chapter 33 South Carolina Code of Laws also details the prescription authority for nurse practitioners. This includes the ability of nurse practitioners to provide non-controlled drugs, which includes Tylenol or Zofran. They are able to prescribe level 3 through 5 drugs, which includes ketamine, testosterone, Lyrica, and Tylenol with codeine. They're also able to prescribe level 2 drugs, non-narcotic, but they are not able to exceed a 30-day supply. These drugs include Adderall and Ritalin. They are also able to prescribe level 2 drug narcotics, but they are not able to exceed a 5-day supply. And these medications include oxycodone and Vicodin. The exception to the level 2 drugs narcotic rule is if a patient is in hospice or palliative care. And in those situations, the nurse practitioner is able to prescribe a supply longer than 5 days. So in conclusion, South Carolina is a restricted practice state, which requires the nurse practitioners to enter a collaborative agreement in order to practice. Nurse practitioners are able to prescribe class 2 through 5 drugs. And all of the details as far as the rules and regulations for nurse practitioners in South Carolina are outlined under the regulations of South Carolina Code of Laws, Chapter 33. And these are my references for you guys. I hope y'all learned something. Thanks.